It is crucial to understand that the two types of incontinence have very different treatment strategies. Urgent incontinence is first managed by discussing your diet and making sure to reduce irritants such as coffee, soda, tea, artificial sweeteners. We can also consider referral to a pelvic floor physical therapist for help with pelvic floor rehabilitation to help hold the urine longer and retrain the bladder. Next, there are medications available that help relax the bladder to improve urgency, frequency, and leakage associated with urgency. And these typically can be very effective. If none of those modalities are effective to the woman's satisfaction, then there are advanced therapies. And these include Botox injections in the bladder and also something called sacral neuromodulation. Botox can be injected in the bladder during an in-office procedure whereby a small scope is inserted into the bladder and then multiple different locations within the bladder are injected with the Botox medication. Sacral neuromodulation, on the other hand, is a staged procedure performed in the operating room whereby a small electrode is placed alongside the nerve that innervates the bladder, and this is connected to a pacemaker-like device implanted just above the buttock. This helps to normalize overactive nerve activity. There are both non-surgical and surgical treatment options available for management of stress urinary incontinence. Non-surgical treatment options include pelvic floor physical therapy to help strengthen the pelvic floor muscles to prevent leakage during laughing, coughing, sneezing, and exercise. Alternatively, there are vaginal inserts that help to prevent leakage with the same mechanism. Surgical options for management include periurethral bulking agents and midurethral slings. Periurethral bulking can either be performed in the office or in the operating room. It involves a bulking agent being injected beside the urethra, which is the tube that urine empties from the bladder, to increase the resistance so that a woman doesn't leak during activity. Midurethral slings are performed in the operating room and is a same-day operation and has a similar mechanism of action to increase the resistance during laughing, coughing, sneezing so that urine can't escape. Urinary incontinence can be physically bothersome and have significant negative psychological and social effects. It can be expensive, physically exhausting, and socially incapacitating. We encourage all women suffering from urinary incontinence or overactive bladder symptoms to discuss this with your physician and consider referral to a urogynecologist to discuss treatment of these problems. There are options available for treatment, and we can help improve your quality of life and day-to-day function.